and addressing rather social and economic or pressing social and economic needs. Getting it wrong could also have dire consequences, and we all know that this is our story here in Ghana as well. So let's cross over to William Glowcroft, political correspondent with our partner DW, who's joining us from Berlin. William, it's good to have you working from home. So tell us, how have the new rules been going around Germany? We've had a little bit of a chat about it with Thomas Sparrow, but what's your own perspective and the addition there?
Yes, and welcome back to my home, as always, where many of us are working from. Well, we are about halfway through the first week of some very small loosenings of the rules that have been in place for the better part of the month, or since the end of March, I should say, to try to stem the outbreak. Berlin, for example, just decided on what exactly the new rules were going to be. We have to keep in mind that Germany is a federal system, so despite what the nationwide rules might be, how those rules actually get implemented, those are decided on a state-by-state basis. So we see a wide range of differences across the states. For example, here in Berlin, they're not only allowing small shops to open, they're allowing also big shops to open as long as they restrict the amount of access the public has to floor space, and they restrict how many people are in a store at once. So that's a clever way around the national restrictions about how big the stores can be. Another difference is schools are not supposed to be open until May 4th, but again, here in Berlin and other states, they're starting schools already, or some schools, next week. Some students are back to taking exams already this week. So we're seeing a considerable amount of differences throughout Germany, depending where you live. And that could have significant impact on how the infection continues to be controlled here in Germany. And that's what government officials and public health officials are really concerned about, that individuals, that the public will continue adhering to the rules, social distancing, hygiene, wearing masks where required in public and in public transit. That really is going to decide if the infection comes back or if it can continue to stay under control as it has been.
It'll be interesting to see what that is. But there's been a lot of conversation in the United States of America, here in Ghana, about the effects, of easing these restrictions, because people have said that we're not sure yet whether it's a good time to ease the restrictions, but we have. So we'll be comparing notes as we go along. But for health, the public health experts, they'll have their own expectation and understanding of the situation. What exactly will people like that be watching as public life, eases back into normality?
Well, shortly put, or simply put, the infection rate. Right now, or as of last week, when these easings or these new rules were put into place, the infection rate, the reproduction number, was 0.7. That was quite low. 0.7 means that the outbreak is slowing down. It's not spreading to more people. Public health officials say that that reproduction number needs to stay under 1. To be a sign that the outbreak is slowing and not spreading. But by early this week, that reproduction number was up from 0.7 to 0.9. So public health officials are really tracking closely that number as the days go by over the next 2 weeks, because of course 2 weeks or 14 days, that is what's thought to be the incubation period for this virus. And every 2 weeks, therefore, is what public health officials will be advising and consulting with the government about whether to continue easing the restrictions or if they have to take a step back and reimpose some of the restrictions. Angela Merkel said already that she's very concerned about there being a rush to easing restrictions, and all of these hard-fought successes, these temporary initial successes that Germany has enjoyed and worked really hard to get in the last several weeks, might be for nothing if the restrictions are eased too quickly, if people return to a sense of normalcy too quickly, and infections do spike back up.
I was just going to ask you whether or not, based on the point, you talk about 0.7, which has now gone up a bit to 0.9. I'm thinking, are they linking this to the easing of restrictions on movement at all?
It's too soon to tell, and that's why the government is looking every 2 weeks, because day to day, infections may go up, infections may go down. There's a number of reasons that could happen day to day. That's why you need the slightly bigger picture of 2 weeks to really see if there's a trend, if there's an upward trend or a downward trend in infections. But it is worrying that the reproduction number went up to 0.9, which is just below that magic number 1 that public health officials say need to stay below. But also in Germany, and everywhere, there's of course a lag. There's a lag from the time that a case is reported positive to the time that a person might go to the hospital, to the point that a person might unfortunately die of the disease. And that's what we're seeing now in Germany, that many older people who have been suffering from this virus are starting to die, unfortunately, and those numbers then spike now. That doesn't necessarily mean that the condition or situation in Germany is getting worse. It just means that cases that we've known about for weeks, they're finally coming to their tragic conclusions in some cases. So we have to look at over a period of time, over weeks, 2 weeks, if those numbers are going up or going down.
Same thing we've been told, not about the number of casualties, by the way, but about the number of cases we're recording. As of yesterday, we're at 1,042. Right now, we're at 1,154. And we're being told that when we see the figures change like that, it didn't happen between that 24 days. So within that 24 hours, I should say. So that makes perfect sense. Let's talk about the steps going forward. What could be the next steps?
The next steps are going to be, if things go well, if the infection rate stays under control, is going to be a slowly further opening of the economy and of public life. Schools will be next. The big question, though, is, of course, younger age schools and preschools, where it's harder to get kids, of course, because of their age, it's harder to get them to maintain social distancing. Also, public gatherings, for example, in Berlin, starting on May 4th, public gatherings of people up to 50 are going to be allowed in the open air. But again, all of these rules are dependent on that people maintain social distancing, they wear masks, they uphold good hygiene, such as washing their hands. Otherwise, these kinds of things will not be allowed. Also, museums, other public institutions, libraries, these might start opening up. Religious gatherings might be allowed again. Those are the things that experts and, of course, the public itself is very much eager to get back to. And, of course, cafes and restaurants, so people can go out to eat and drink and enjoy a night out. But again, it's going to require social distancing. It's going to require a great deal of care. Otherwise, the infection rate could go back up, and government officials may be forced to reinstate some of the restrictions that we've seen over the last several weeks.
Hopefully we go for the former and that actually happens. Thank you, William, so much for the update. William Glowcroft is political correspondent with our partners DW, joining us all the way from Berlin. He's working from home, by the way. Well, let's come back to Ghana and have a conversation about what's been happening so far. The NGOs in health, they've been talking. This afternoon, that coalition of NGOs have written an open letter to President Akufo-Addo on government's handling of the pandemic. Dr. Gabriel Banaku is national chairman of the group and joins us via Zoom with some analysis. Doc, thank you for your time this afternoon. Okay, I can't hear you, but I believe that the next time you speak, I'll be able to hear you. My question is for you to, first of all, give us your assessment, or the NGOs in health assessment, of how our response to coronavirus has been so far. All right, let's try and fix that up. But in the meantime, I still have some of your messages here. Let's go through some of those messages and see what you're saying. If you live again in any of these areas which have recorded cases, would love to hear from you. This one says, if courtesy polling Noguchi can, courtesy polling Noguchi, I'm not sure what you mean, but you say, if courtesy polling Noguchi can test as many as 10,000 cases a day, it stands to reason that Noguchi's capacity is no more 1,000. Something is not right. Musa from Nima is sending this. Musa, I'm not very sure what your message means. Yeah, I'm not really sure. This one says, good evening, Gifty. I will suggest to the authorities to conduct mass testing in areas where new cases of the coronavirus is occurring to help trap the movement of the pandemic. From Nuesan Obed Azabzugu in the northern region. Obed, thank you for sending your message to us. Farouk is in Tamale. Farouk is texting us from Tamale. He says, now it is alarming the way new cases are coming up. Lifting of the lockdown is a mistaken approach. Farouk, thanks for sending in your message as well. JoyNews, you're doing a good job. Government must subsidize your job. Joel is sending this from Enchi. Joel, thank you for your message. But, well, it's not bad. It's not a bad idea at all. Okay, so this one says, we must all understand that no country in the world was ready for COVID-19. We all must do our little part to defeat this unseen evil. Ura is sending us from Dasibre Pharmacy, Konongo. Ura, thank you for sending your message. I hope Konongo is safe. I hope you are staying safe and encouraging people around you to stay safe as well. My name is Francis Eshen from the western region of Ghana. Please, I want to ask about the decision the government is taking about the country's education as far as the coronavirus pandemic issues are concerned. You're talking about education, and indeed it's one of the issues coming up recently, something that hopefully authorities who are watching will be able to take a cue from. Public education has become a key part of the conversation. People believe that it's not going down well enough. People are not taking this as seriously as perhaps we all should. This one says, as for cases going up, I think Ghana should not be worried about that. But the death rate is what should matter to us. But that one too is, I think, is under control. Thank you for your message. I go over to Dr. Banaku, who joins us via Zoom. Dr. Banaku, can you hear me now?
Yeah, I can hear you loud and clear. Great.
So let's take a look at your assessment. I'll go through your letter, your open letter, and we interrogate it. But let's first give us the Coalition of NGOs in Health's assessment of government's response to COVID-19. So